Today's topic is Sculptra. So what is a Sculptra? Most of the people categorize a Sculptra as a filler, but in reality, Sculptra is not a filler. It is what we consider is a biostimulant. So what it means that it triggers the body to produce more collagen and elastin. Basically uses the body's own properties to improve the body. So how it works is that Sculptra consists of teeny tiny particles of what we call PLLA, poly-L-lactic acid. We inject that and then it will go and basically makes a positive inflammatory response in the body, and then those teeny tiny particles work as a scaffold, so the new collagen and elastin is going to be built around it by the fibroblasts. So we have to inject it in the area that have more fibroblasts. Where are the fibroblasts in the skin? The majority of them is going to be in the subdermal area or in the periosteal area. So with two places we inject the Sculptra. One is going to be right underneath the skin in a very specific depth, and then the other one is going to be deep on the bone, basically, so to produce most of the collagen and elastin. So how Sculptra is different than a traditional filler. Traditional filler comes prepared as a gel in the packaging. We open the package, put the needle on the syringe, inject, and I tell my patients what you see at the end of the injection is what you get, and over the course of time it will go down. Sculptra is different. Sculptra comes as a powder. So when we want to inject it, we have to mix it with water to make it liquid to be able to inject the Sculptra. So I tell my patients the immediate gratification that comes with the Sculptra is not from the Sculptra itself, but it's from the water that we added to the liquid to be able to inject it. So I inject the patients. At the end, they're going to look in the mirror and they're going to say, okay, it looks better, I am improved. And then they're going to go home, and then second or third day, they notice that everything is gone. They're back to their baseline, basically. And then that's the time that the teeny tiny particles of a Sculptra, it starts working. It takes time. So how many vials you need is, I tell my patients, rule of thumb, you need about 1 vial per decade of your life. So it means if you're in like 40s, you need between 4 to 5 vials. If you're in your 50s, you need between 5 to 6 vials. So how we inject it? I prefer to inject 1 vial every month to month and a half. How do we gonna spread it out? It's not gonna be the whole 5 vials or 6 vials at the same session. That's the most common mistake people do. I like to spread it out 1 vial every month, month and a half, 2 months. Ideally between 1 vial every month. But if you want to have more recovery time between them, you can do 1 every 2 or 3 vials, but it takes longer time till you get to the effect that you want. So you come, I inject, you're gonna see some improvement, and you're gonna go home. Sculptra comes with a little bit of a homework for the patients. I tell my patients, after the injection, you're gonna follow the rule of 5 times 5 times 5. So what it means, you're gonna massage the area that is injected 5 minutes, 5 times a day for 5 days. I've never had any patient who followed this rule and they have any problem with the Sculptra. Usually I tell my patients, even after the first injection, after the first vial, you're gonna see an improvement in the skin, so what we call it Sculptra glow. Sculptra is the only filler that not only gives you some fullness from the underneath the skin, but it will tighten the skin, so it'll basically shrink the skin and fill from the underneath, and then it's the only filler that will improve the skin texture and the quality. That's the reason I tell my patients, even after the first injection, you're gonna have some glow in your face in a very good way, so what we call it is called the Sculptra glow. What areas we can inject? Basically, again, any area that we could go in a specific depth underneath the skin, or any area that we can go above the bone. So basically, rule of thumb is that the areas that I don't want to inject are around the eyes and around the mouth. These are the injection areas that the skin is a little thinner, so it has more chance of having a side effect. Rest of the face, we can inject. My favorite areas to inject with the Sculptra, I tell my patients, is that the areas that the guys have beard and a mustache, basically anything from here down. I can go inject from the jawline, give them a definition of the jawline, tighten the skin area a little bit more, go to the nasolabial fold, go to the marionette line, go on the cheekbone, add more definition to the cheekbones, specifically hollowness in the temples. Temples are the most underappreciated areas of anybody's face. As we get older, we lose the volume in that area, and part of that reason that we have our face coming like, when we are younger, the eyes are like this, kind of upward, and as we get older, it becomes wide and kind of goes down. One part of that is because of the volume loss in the temple. So, but people don't pay attention to that area. After I inject with the any filler in the temple area, they notice the big difference.